Good morning. Good morning. Is it morning? Yes, where I am, it's morning. Where you are, it may not be, just barely still. So welcome. We're glad you're here with us today. Looks like we have quite a crowd, and hopefully that will continue to grow. But in the interest of your time and getting to this interesting content, I really want to begin our webinar this morning-ish. Today, my name is Erin Ficker. I'm one of the co-managers, co-prevention managers at the Great Lakes Prevention Tech Transfer Center. And today we will be talking about the nexus of substance misuse prevention and mental health promotion. This webinar is brought to you by the Great Lakes PTTC and SAMHSA. Today's webinar is brought to you by the Great Lakes PTTC under a cooperative agreement with SAMHSA. It's important to remember that nothing that is said here today is a reflection of the opinions expressed are of the speakers and do not reflect the official position of HHS or SAMHSA. At the PTTC, we believe that language matters and words have power. We believe in people first language, and we use affirming language to promote the application of evidence-based and culturally informed practices. Again, I am so delighted to have you all here with us today. Just a few housekeeping items. If you're having any technical issues, please individually message Rebecca Buller or Alyssa in the chat section at the bottom of your screen, and they'll be happy to assist you. If you have any questions, you can put them in the Q&A tab at the bottom of the screen. You'll see it says Q&A. You click on that and write your questions right in there, and we will get to those throughout the at a few stopping points in the webinar, and then again at the end. Few more things. If you would, you will be directed to a short survey at the end of the presentation, and it is so helpful for us if you can please take a minute or 3 to fill that out. And we will be providing certificates of attendance via email to all those who attended the full session. So we like to stay connected, so please visit our websites, join our mailing lists. We're on social media. We're on Twitter and Facebook, where you can see our podcasts and our YouTube channel to see some of the work that we've already done. Those links are in the chat there, so please feel free to learn more about us and to check us out on social media. We always try to have an interesting conversation happening on Facebook, especially after a webinar like today's. So again, today we're going to be focusing on the nexus of substance misuse prevention and mental health. My name is Erin Ficker. I have been in the field of prevention for 17 plus years, and I'm excited to discuss this topic today. Today is the third of a 3-part series on the nexus of substance misuse prevention and other behavioral health topics. So previously, you'll see we've completed one on substance misuse and suicide prevention. We finished one on substance misuse and gambling prevention. And today we'll be focusing on substance misuse prevention and mental health promotion. In our previous webinars, we really did discuss the intersection of substance misuse and another behavioral health issue. So we kind of crossed those 2 behavioral health issues. Today, we're really going to be talking a little bit more about 2 approaches and the nexus of where those 2 approaches to addressing behavioral health or 2 behavioral health issues kind of connect. Our objectives today are to discuss the complex relationship between mental health disorders and substance misuse, to list the shared risk and protective factors between mental health and substance misuse disorders, list shared strategies for promoting mental health and preventing substance misuse, and then describe opportunities for the substance misuse prevention and mental health promotion fields to collaborate. It's important that we kind of lay the groundwork and learn a little bit about this nexus and before we dive into how we can work together on it. I want to be clear that we are really focused on professionals working in those two fields in substance misuse prevention and mental health promotion. So this may be helpful for those of you who work in those fields or educational to those of you who maybe don't, but hopefully you'll learn a little something today. Okay. So I want to start with the importance of understanding the co-occurrence between mental health disorders and substance misuse or substance use disorders. We know that mental health and substance misuse impact each other, given that they have shared risk and protective factors. They can be both a risk factor and a consequence of each other. So we know that mental health disorders can be a risk factor for substance misuse, and substance misuse can be a risk factor for mental health disorders. We also know that understanding co-occurrence is important because it really does increase the severity and worsen the prognosis for both disorders. So when they co-occur, they do create more severe conditions. And then we want to really focus on how prevention and promotion can address the same risk and protective factors that are shared or work together. So we want to focus on the co-occurrence of risk and protective factors, the co-occurrence of the disorders, and then how we can address those. So let's start with some definitions. So mental health promotion, and sometimes it's hard to get your head around the difference between prevention and promotion. And I know that it's not an easy task. So to think about mental health promotion, we think about attempts to encourage and increase protective factors and healthy behaviors that can help prevent the onset of a diagnosable mental health disorder, or reduce risk factors that can lead to the development of a mental health disorder. So we really here, I want to focus on the encourage and increase protective factors. Much of promotion is focused on increasing environmental protective factors. It's also focused on helping to prevent the onset or reduce the chances of the onset of a mental health disorder. We know that mental health disorders are oftentimes not preventable, but if there are things we can do to reduce, to increase the protective factors, then that's what we're looking to do with the promotion of mental health. The definition of prevention is just slightly different. There's two definitions that I like to talk about, and one is a proactive process of creating conditions and fostering attitudes that promote the well-being of people. And that's just, it's proactive. Promotion is proactive, and so is prevention. So this first definition of prevention really does very nicely kind of sit with that definition of promotion. But the more specific definition that I also like to look at is one from SAMHSA. It says that prevention is interventions that occur prior to the onset, so we heard that before, prior to the onset of a disorder, and are intended to prevent and reduce the risk of substance misuse, right? So here we're trying to prevent the use of substances or reduce the risk from substance misuse. So prevention's slightly different. We see just a slightly different, especially in the second definition, a slightly different understanding of the two. And a better way, or maybe a more comprehensive way to look at the difference or the commonalities between the two is to look at the spectrum of mental, emotional, and behavioral health interventions. Some of you may know this as the continuum of care, but it was recently updated and renamed, and you'll see it looks different than it once did because they've really increased the role that promotion plays in this, in the spectrum, right? So you see promotion all across the bottom, that it's always happening, right? That it's the environment, the air in which we breathe is where promotion lives. But there are also promotion activities that can happen at each of these slices, and that that beginning of that promotion section where it's societal, community, and individual and family promotion activities. So we really want to think about, before we even get to prevention, we want to think about that promotion and that focusing on creating well-being at those 3 levels. And then we get into prevention, where we're really reducing the risk factors for disease, and then moving upstream from universal, selective, and indicated, where we're talking about everyone in a community versus those who are more at risk versus those who are already showing signs of use. And then we move into treatment, maintenance, and recovery. So, so that's the end of the new spectrum. And what it really does is it talks about promoting well-being before we even get into the idea of preventing disorder, right? So, and it does, I love the across the bottom, right? That's something that I think is important to remember, that promotion happens and exists and coexists with all of these things. So while promotion is its own thing, and that first part of the pie, it's also, it happens at the same time that prevention's happening. And this is where we start to see the nexus of these two. Okay, so let's dig in a little bit more to this concept of this nexus, right? So substance misuse disorder and mental health disorders have my little Venn diagram, right? So there is this overlap. So 9.7 million adults experience substance use disorders. 42 million adults experience mental health disorders. So a lot of mental health disorders compared to substance use disorders, but there's still that overlap. Alcohol use disorder is the most common of our substance use disorders that we see. And in mental health, we see that serious SMI, or serious mental illness, is experienced by 1 in 20 of those 42 million 42 million adults. Interestingly, we see that substance use disorder is most prevalent among men, and mental health disorders are most prevalent among women. In the middle of this nexus, we have 9.5 million adults who have this kind of overlapping of the two disorders. We do know that about half of people with a substance use disorder will develop a mental health, or also have a mental health condition. And like I'd said before, the combination of the two often worsen the condition or increase the severity of the condition. We know that outcomes are generally worse when people have both. So young adults are more likely to have both. People who have both disorders are more likely to have physical health problems, be involved in the criminal justice system, or be at higher risk of suicide. And we did have that conversation earlier about the nexus of suicide and substance misuse. And so we see that coming up here again. So there is some things here that, might skew this data. For instance, women are more likely to seek care for a mental health disorder than men. So even though it says men are more likely to have substance misuse disorders, women are equally likely to develop substance use disorders. We believe that it's more common, but they are equally likely to develop substance misuse disorders. So, okay. So I'm going to answer this question. So regarding the Venn diagram, I thought SUID was included in the DSM-5, and therefore all SUID would be included in mental health disorders. Can you help differentiate? Absolutely. We're pulling this apart and taking substance use misuse disorder as its own. And I'm not as familiar with the DSM-5 and how it's listed. I think it is listed as a mental health disorder. However, what we're trying to do here is look at substance misuse and substance. Here we're talking about disorders, but we're also going to talk about that's just substance misuse in general. So I hope that helps. We want to pull apart the two and look at how they relate, because they are highly interrelated. Okay. 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 So this often is thought of as kind of a chicken and an egg situation, right? So which comes first? If mental health disorders lead individuals towards substance misuse, or substance misuse leads individuals to the onset or the worsening of mental health disorders, does it matter which comes first? Kind of. Likely no. When we come at it from a prevention and promotion angle, probably not, right? We just want to address both of them. From a clinical individual perspective, I think obviously there is an importance in understanding the relationship between the two, but we're backing up from this public health perspective and looking at population level influence of prevention and promotion for mental health and substance misuse. So we need to address both at the same time and in different ways. Okay. There are really complex interactions between these two. We know that substance misuse has been shown to impact mental health conditions, so I've kind of mentioned that before, and that mental health conditions have been shown to impact substance use behavior. So we think of this as kind of the cycle of they can trigger, so substance use can trigger the onset of a mental health disorder, not necessarily cause it, but trigger the onset, meaning kind of trigger something that may have already been there, trigger an increased reaction. So we know that marijuana use can trigger or worsen depression or depressive episodes. So there's this trigger component. There's also to alleviate, right? So when we talk about alleviate, we have to think of the term, I don't know how many of you are familiar with the term of kind of self-medicating, where alcohol and other drugs can actually alleviate or temporarily make anxiety feel lighter or better, but it doesn't address the underlying causes, it doesn't address the symptoms, it just helps to, in the moment, alleviate the symptoms of some mental health disorders. But they also both can exacerbate each other. So as we mentioned before, substance misuse can exacerbate and make mental health conditions worse, and mental health conditions can often increase the severity at which we experience substance misuse or engage in substance misuse behavior. So it's a complex interaction, and I think it's important to understand kind of the different ways. There's really not a clean, clear relationship here, which is one of the kind of things that makes it interesting to think about how we address it. So an example, right? So let's think about alcohol misuse and depressive disorders, right? So although evidence supports all these different pathways, right? So depressive disorders can increase the risk for alcohol use disorder. Alcohol use disorder also increases the risk for depressive disorders. Now, alcohol use disorder is not going to cause depressive disorders in everyone, but it can increase that risk. We also know that alcohol misuse can exacerbate other mental health issues. And all of these conditions share common risk factors, which is really honestly why you see that arrow that's just all tangled up is there's evidence that this supports all three of these different pathways to these shared co-occurring disorders, but it's very difficult to figure out and to untangle that web of how we get to this high rate of co-occurrence between, for in this case, alcohol use disorder and depression. And this is just one example. So a lot of the evidence does show that alcohol use may precede depression. So that's something that we are starting to understand, and that there's a shared genetic vulnerability. So that's that shared risk factor, right? So it's a complicated relationship as an understatement. So I've talked a little bit about risk factors already, but kind of like diving in just a little bit more. Both conditions are impacted by risk factors. And when we think about risk factors for these two disorders, for substance use disorder and other mental health disorders, we think about biological risk factors, psychological risk factors, and environmental risk factors, right? So biological would be like a family history or genetic vulnerabilities. We know that there's a genetic link or a hereditary link for substance use disorder. And while it varies among different mental health disorders, that does also exist for some mental health disorders. Psychological risk factors may include things like trauma or risk-seeking behavior or novelty-seeking behavior that's a kind of a psychological trait that may lead people to the use of substances and may trigger mental health disorders. Lastly, environmental. So adverse childhood experiences can lead to both or can be risk factors for both substance use and mental health disorders, as well as stress and a lack of parental supervision is another one. It's just an interesting one that we'll dig into a little bit later. There's so much overlap and interplay here in these categories that it's very difficult to piece apart, right? Trauma and bullying and ACEs, some of those are biological and psychological. Some of it is environmental. It's very hard to pull apart the pieces that are impacting mental health, the pieces that are impacting substance misuse disorder. So the way we want to look at it in considering how we're going to promote mental health, prevent substance misuse, is to start to think about it in the socio-ecological model. And hopefully this is something y'all have seen. The socio-ecological model is a way for us to break down and think about how risk and protective factors and levels of engagement in the world impact our lives and impact our health. So we start in the middle of that circle with the individual. So these are things like the individual experience is a hereditary condition or has a genetic predisposition towards addiction. In the relationship connection, we may see bullying, school connectedness. It's also sometimes called the family or interpersonal level. So this is who are your close associates, who are your teachers. So those relationships do you have strong connectedness and relationships? And then we get into community. So some of the risk factors that exist in that kind of community layer. When we think about the community layer, it includes things like media, community organizations, employers, faith-based communities, those kinds of things. And we think about some of the risk factors there are, do you have access to mental health care? Is there a high availability of alcohol and other drugs in the community? So what are the conditions? And when I start to think of community, I start to use the term the water that we swim in or the air that we breathe, right? So this is the kind of what's around us. And it's the same with societal. It becomes kind of the bigger pool in which we swim or the air that we breathe. And societal can be really around social and cultural norms, public policy that affects healthcare and behavioral health care and outcomes. So things that live in this realm are things like stigma or perception of the acceptance of use. So if people think that it's acceptable to use marijuana or to use alcohol, or if mental health disorders are highly stigmatized, that's a societal factor that can be a risk factor and influence them. So it's just really this way for us kind of to pull it apart. So like I said before, it's super intertwined. It's hard to understand the relationships always, but if we pull it apart, we can, with the socio-ecological model, we can start to see a different relationship. And we can start to kind of see it a little bit more clearly. Still really mixed up, but a little bit clearer. So I want to look a little bit at some specific mental health risk and protective factors, right? So here we have a list of risk factors for mental health and mental health disorders, both risk and protective factors. This is just a sampling. These all come from research and evidence-based research that shows us that these risk factors exist for mental health disorders. So they include things like genetic predisposition, substance use, poverty, violence, inequity, harsh parenting, bullying. In protective factors, we see things like social and emotional skills, quality education, safe neighborhoods, community connectedness. So you start to see how they pull apart into those layers when you start to look at them this way. But it's really important, and I just want to hazard this warning that while these risk and protective factors help us understand what may lead to or put people at risk for mental health disorders, they only have limited predictive strength. So just because you grew up in poverty, or you live in an impoverished community, or if you have a high quality education, those are only risk factors. It's just that it's more likely that you would or would not develop a mental health disorder. We're not determining that everyone who grows up in these settings or everyone who lives in these settings or has these genetic predispositions is going to develop those disorders. And I think that's just an important component to note. It's the same when we look at risk and protective factors for substance misuse. Again, they only have limited predictive strength. So risk factors for substance misuse include genetic predisposition to mental health disorders, exposure to alcohol prenatally, so some of those individual risk factors in that individual layer. Parents who suffer from mental health and disorders and substance use disorders that put people at risk for substance use disorder or substance misuse. And again, that's maybe that relational level that we start to see. Community laws and norms that are favorable to substance use, lack of adult supervision, and easy access to drugs or alcohol are some of those risk factors. And again, you can kind of see how those kind of layer out in that socio-ecological model. Protective factors include social and emotional skills, attachment and bonding to family, positive social norms, meaning there's a positive understanding that not everyone uses drugs or alcohol and that the norms are of positive behavior and that's understood. Opportunities for pro-social involvement. So that's often we think of like community activities, after school programming, out of school time activities, and community events that are pro-social and often alcohol-free. Recognition of pro-social involvement. So that's another protective factor. So again, you can kind of see how those straddle, but what we also see that socio-ecological model, but we could also see as we get back to this overlapping risk, right? So with this overlap of substance misuse and mental health disorders. And notice that I'm talking not about substance use disorders here, but I'm talking about substance misuse, right? So the overlapping risk factors that we know, the risk factors include genetic predisposition is a risk factor for both. Exposure to violence is also impacts both. As in the protective factors, social and emotional skills and community connectedness are protective factors, again, for both mental health disorders and substance misuse. So these are really those commonalities from those lists that I showed you before. And it's important that we know this because we want to get into how we can address them and how we can collaborate, right? So what can we do about this? And how do we do it together? So understanding overlapping risk and protection is really important. So we want to think about there, what are the areas of key collaboration, right? So mental health promotion, which again is kind of this idea of promoting those protective factors and reducing those risk factors at a population level. So mental health disorders are difficult to prevent because they are, an individual experience, and with risk and protective factors that that exists throughout that socio-ecological model, but the individual experiences are very different. And because many of those risk factors fall inside the individual category, addressing them at a population level can be very difficult in terms of prevention. So that's why in mental health, we really turn to promotion. So at the population level, when we think about addressing and creating environments for everyone, impacting mental health outcomes is done kind of in this environmental level, kind of that social, that community and societal level that I refer to as kind of the air we breathe, right? So, and the communities that we live in. So some of those approaches include things like early childhood interventions that are available in a community, providing support for children. So some of that, getting some of that social and emotional learning and support for children who may have risk factors from family experiences. So sometimes we look at that as like providing that support in the community. Programs targeted at vulnerable groups, incorporating mental health promotion activities in school. So this is an interesting and hot topic lately, but those are things like social skills and life skills activities that are taught in schools. Violence prevention programs and community development programs that help address community violence, community poverty in a community, kind of developing stronger, healthier communities in general. Looking to reduce poverty and build connectedness is what we would be doing with those community development type programs. Okay. So are some of the things we do in mental health promotion to reduce risk and increase protection, right? So let's think a little bit about some of the strategies. And many of you may be very familiar with this if you are someone who comes from the world of prevention, is the examples of some of the strategies we use in substance misuse prevention. Excuse me, so parent support and education. So when you think about parent support and education, that's really that relationship or family level. This goes alongside with the promotion activity of providing support for children. When we look at school-based life skills curricula, that again kind of maps on to some of the incorporating mental health promotion activities in schools. That as a component of, not the only, but a component of. And that really exists at that community level, right? That school level. Educational campaigns, that is really our, interestingly, we think of educational campaigns as existing in the environment and people see them, but they're often targeted at individual behaviors. So I actually think of them addressing individual risk factors, but through an environmental approach. We also think about community alcohol drug policy changes. That's that societal level of what are the policies in our community around alcohol and other drugs. And then the other one is enforcement changes. You know, this is again that community and society level. What are we doing to enforce the alcohol, drug policies we have in place? So these are all getting to very specific risk factors. I'm just going to pause really quick and see if there are any questions. You know, someone's asked a question about the Venn diagram that half of those with SUID also have mental health. Is the difference? So that's one I would have to go back to the data and get an answer for you, and I can do that. But I don't have that answer off the top of my head. Someone has their hand raised. I think if you want to type in the chat, you can do that. Otherwise, we will continue on. So you can either type it in the questions or you can type it in the chat. And I think it's Tamar, you have your hand raised. Okay. Okay, so I have another question. So all too often coalition work is focused on individuals and families, but we miss the opportunity to clean the pond if you will, with organizations, communities, and policy work. In the socio-ecological model, I think that's what you're referring to, you shared it didn't have that fifth layer of policy, specifically any recommendations on which to use. So society is where I put policy in that layer. And in terms of thinking about specific policies, that's something we can get into a little later, because it's pretty specific, but we can talk about policies that impact reduction in poverty when we think about, and reduction in violence when we think about mental health promotion. In substance misuse promotion, those policies are generally around the availability and enforcement of alcohol and other drug laws. So hopefully that was helpful. Okay, we're going to keep moving on because I want to get to this idea of where these two things come together, right? So mental health promotion are actions to promote safer environments, healthier lifestyle choices, and increase positive mental health. These are happening at the environmental level, the community level, the society level, building environments that decrease the potential severity or increase treatment availability, and reduce risk and protection, and build promotion to reduce severity. Mental substance misuse prevention are actions to prevent and reduce the risk for substance misuse. And so individual, community levels is where often we're looking here, and we're supporting good choices. We're teaching skills, building an understanding that impacts the likelihood that you'll choose to begin use. If we're addressing mental health, we are also reducing the likelihood of engaging in substance misuse. And if we're preventing substance misuse, we're reducing the chance of increased severity of or increased onset of a mental health disorder. So the two absolutely interact with each other, but it's also important, and I'm just going to say it again, that no one of these risk or protective factors that we've talked about are predictive. So we address as many as we can in the ways that we can. Okay. So here we go. Overlapping and complementary strategies. So someone just asked this question in the question and answer, and I think it was very timely, right? So as they say, it's challenging to distinguish and differentiate between promotion and prevention with the approaches listed, since from one perspective, they could be prevention, and another perspective, they could be considered promotion. For example, early childhood interventions could easily be defined as a prevention approach of reducing risk factors present at this age range, right? Okay, so you're right. They often are very blurry, but we know that also, for example, early childhood interventions are likely to reduce risk factors that occur at this age that then impact later use. But we also know that early childhood interventions can promote mental health by increasing them. So they do both, but we're coming at them kind of from different angles. One is kind of trying to reduce the likelihood of the onset of a mental health disorder, and the other is really trying to specifically reduce risk factors for gosh, I keep losing my words. I'm so sorry. For substance misuse. So you're absolutely right. It can be really difficult to differentiate, which is one of the reasons why we want to look at how these strategies overlap and complement each other, right? So for prevention professionals, we're often doing social, school-based life skills curriculum. We're doing mentoring programs, building community collaboratives, and providing parent support education. While mental health and other community partners are often engaged in early childhood interventions, programs that encourage help seeking and reducing stigma, which is wonderful, violence prevention programs, and home visiting programs that address issues in the home. Now, these strategies, some of them would overlap. So school-based life skills curriculum can address risk factors for both mental health and substance misuse, but who's doing them more, and are we thinking about each other when we're doing them, right? Building community collaboratives helps to build those stronger communities. And again, as prevention professionals, as we're engaging in these strategies, are we thinking about also how they promote mental health, right? So when mental health providers and community health partners are engaging in violence prevention programs or home visiting or programs to reduce stigma, are they also thinking about how that impacts substance misuse disorders? So that's really what I'm trying to focus on here, is knowing that there are shared risk and protective factors and shared strategies. They don't always align, but they often complement each other. So we want to work in our communities to reduce the overlap or the duplication of effort, and address as many of these strategies as possible, or the issues as possible, using as many strategies as possible that cover that full continuum, that full socio-ecological model. And then think about, you know, how we can partner with each other to reduce the risk of the dangerous of co-occurrence of these two disorders. Okay. Why is collaboration challenging? This one's pretty, this one's important, right? That we think about why collaboration is difficult. And one of it is really this difficult in understanding the difference between promotion and prevention, and where are those lines. And it is not an easy understanding. There's a complex set of risk and protective factors that interact with each other, that make understanding the relationship difficult. It's important too that we understand what risk and protective factors address both issues, which risk and protective factors address only one or the other, and how we address them then to the appropriate, for the appropriate outcome, and who's doing that and with what strategies. Yep, so difficult, different settings. So community coalitions is often where our prevention work is stemming from. It's collaboration of social organizations, community organizations, youth serving organizations, those kind of public serving organizations at the community level, versus often we see mental health promotion being promoted, lots of promotion there, being addressed by and carried out through healthcare agencies or public health departments. Another is often a difficulty or a difference in training. And this is one of the things that we see come up a lot, is a difference in understanding between a public health approach and a clinical and individual health approach. So in mental health promotion, it's really promoting mental health through a public health approach versus a clinical individual approach. So it's important that we understand that we might be looking at the problem from different angles, and that we might be looking at them from different training, and that we might be coming and speaking different languages, right? Someone mentioned, I think also, that funding silos, so different funding sources can also be a barrier to collaboration, but I would challenge that thinking and say, let's turn it around and think about how I'm being funded to do something and you're being funded to do something. Let's make sure that we're doing our best to make sure that that work complements each other, and that way I won't duplicate your effort and you won't duplicate my effort. So it's another way to say, let's like make the most of the funding that we have. Okay, so ways to improve collaboration. So thinking about this, you know, and in some ways they're really the converse of each other, but it is important that we explore and learn the difference between promotion and prevention, and spend some time there. It's, again, it's not easy. It's not clean. It's not like the continuum where you go from prevention to treatment, which feels a lot cleaner. But when you go from promotion to prevention, it does become more, it's a little fuzzier. So we need to learn and explore that difference. I would encourage you, as a means to improve the collaboration, to think about and learn about what promotion work is happening in your community. So find out, what is it that your community is doing intentionally as mental health promotion, and what they may be doing that's not intentionally mental health promotion. Do you have a really good violence prevention program, or a community development and community building programs in your community? Are the folks leading those programs thinking of that work as mental health promotion, or are they just doing that work as violence prevention? You can start to learn about the work that's happening that addresses mental health and that promotes mental health, addresses mental health risk factors, and also learn about the work that could be addressing the prevention or the mental health, oh my goodness, the substance misuse risk factors, and you can start to see the full spectrum of what's happening in your community. So learning about the promotion work, if you work in prevention, and if you work in promotion, or if you work in mental health, what's happening in prevention. So understanding each other's work is going to allow you to ensure that you are covering a full spectrum and that you're not duplicating effort. Like, we really want to make sure that we're not all like, hey, we all want to come into the schools and do a curriculum about only slightly different things, but there's super a lot of overlap, where instead you can talk to each other and say, we really want to address this, and we really want to address this. Let's see if we can find a school-based curriculum that one of us can implement that will address both things and both outcomes. So you want to know about what's happening, so you can work together and avoid duplication. Focus on your shared goals. You have shared goals, and that's for healthy communities. Focus on those shared outcomes that you want to see, and ways that you can collaborate. So even though you may have different funding, though you may see things differently, you ultimately can find common ground. And I would suggest that as a prevention provider or a prevention professional, you probably have a lot of experience in talking about shared goals and talking about collaboration if you are someone who has built and developed a a coalition, right? So you're used to sharing this. So I would encourage you to take a lead on bringing mental health promotion and mental health professionals into this conversation. Help mental health understand prevention. So again, make sure that you have clear messaging that speaks the same language, that explains things in ways that mental health thinks about them, so that you're communicating with them the work that prevention does in a way that's clear and makes sense to those partners. And communicate with your other partners to make sure that they're also having those conversations. So again, it's about really bringing this network together. It may not be a coalition with a table that people sit around, but really a network of different individuals and organizations and agencies that are working together to address a series of issues that overlap and interlock, right? So if we can't pull it apart, then let's just all address the different components of it and have that impact together. So I'm going to stop there and see if there are any questions that have come up since the last set of questions. So it's challenging. So, okay. I think I've addressed all the questions that I see. If there are any other questions, we can stop here. Okay. If not, I will continue on to think about our key takeaway. Oops. Key takeaways. So in prevention, mental health prevention and promotion, where they come together, we want to make sure that we address shared risk and protective factors, right? That we identify them and address them, whether we are addressing them or someone else in the community is addressing them. We want to make sure that they are being addressed. We want to focus on shared outcomes. So again, we're all in this work together. We very much have the same goals, and staying focused on that helps to make sure that we're not getting lost in the details that can get in our way. And collaboration really is the key here, that by collaborating, we, by collaborating, we're able to have that bigger impact. Like I mentioned, that network, right? We're able to have a larger impact if we're all collaborating and making sure that we're addressing all of those shared risk factors and focusing on a shared outcome. When you think about the action steps you want to take moving forward, you want to learn more about mental health promotion in your community, include mental health professionals in your coalition, or if you're a mental health professional, don't wait to be invited, right? So go find your local prevention coalition and say, hey, I'd love to be a part of this. I'd love to learn more about this. Build awareness of the relationships between mental health and substance use. So that's not just for yourself, like we talked about earlier, but this is help build that awareness in the community, help build that awareness among social service professionals in your community, so that people understand the importance of addressing both of them, the risk factors for both of them, and how they interact. And then think about, and I already said, review ways that risk and protective factors can overlap and how they can be addressed through collaboration. So thinking about the risk factors that you know and the protective factors that you know to exist in your community for substance misuse prevention, start to think about how those overlap with existing risk and protective factors that are related to mental health disorders. And then think about how you can address them or how you may need to partner with or bring someone else on. To hear more about, to hear more about their work and learn more about their work. So those are the action steps I would encourage you to take moving forward. So I did see there is one kind of question-ish in the chat that says, I'd love to hear more about what you consider community mental health promotion. So we talked a little bit about this earlier, and I'll talk about it again too, is anything you're doing to address the risk factors related to mental health risk and protective factors. So thinking about creating an environment in which we address those things. So for example, making sure that there's access to mental health care in the community. And that may be outside of your reach as a prevention professional, but it's not outside of your reach to advocate for that, right? Violence prevention programs that exist to help reduce violence in a community, which we know is a risk factor for mental health. Promoting parenting programs and positive parent-youth engagement, so providing opportunities for youth and parents to engage in pro-social activities. Early childhood interventions is something that we've talked about, and that's really to make sure that we're building strong foundations for children at an early age and intervening when we start to see issues arise, mental health issues arise even in young children. So those are some examples. Anything that we have traditionally thought of as substance use prevention. So not necessarily, but kind of. We may not have thought of a violence prevention program as substance abuse prevention. We may not think about community development. We may not think of employment. We may not think of the reduction of health disparities as the work of prevention, but it can be. But it is also very clearly the work of mental health promotion. So reducing health disparities, reducing racism in a community, creating healthier, safer communities through a number of actions that we may not have seen as directly as prevention programs, substance misuse prevention, are really the work of mental health promotion, but they do support each other. It looks like we have a question. Becky, we'll be providing you with the slides, and you're always welcome to use the anything from the training. So if you'd like to share with the law enforcement in your community when you do this training, I think that would be wonderful. Wonderful. Okay. Any other questions? Why is my slide not advancing? There we go. Any other questions before I move on? Looks like I have one. I work as a Communities at Care Corner. They have a chart of risk and protective factors and how they align with affecting 6 behaviors and health outcomes and the 4 tiers of life in which they fall. Does mental health have any kind of chart like this? Oh, to show risk and protective factors so that we can correlate and truly, that's a great question that I don't know the answer to, but how wonderful would it be if we could find something like that? So I'm going to take down that question and actually ask the tech team to record that question for me, and I'll see if we can't find something like that. And if we are able to find it, we will share it with y'all. That's a great idea, because we do in prevention have a lot of information on how risk and protective factors align and where they fall. So that's fantastic. It's a great question, and hopefully we can get back to you. Yep, you can always look into the 40 developmental assets, which lists risk and protective factors, and I'm sure there's overlap with substance misuse. Anytime you're talking about developmental assets, you know, that's working to build healthier communities and healthier individuals. Okay, other questions? Other comments, things to share? Well, if not, that is the end of my formal presentation. So I'd like to invite you to continue to engage in some of the trainings and technical assistance we have here through the Great Lakes Prevention Tech Transfer Center. One of the great ways to engage with your peers and colleagues across the region is to follow our Facebook page. We often will post conversational questions or videos that you can use in your own work, or you can share examples with your peers. You can ask questions there. And so we will share a link at the end of, once we get the recording done, and there'll be a link set on our webpage. So if you want to follow our Facebook page, just click the following and then like it, and you'll see it come up in your feed. We do have a number of exciting upcoming trainings. So we have a virtual SAPST, which is the Substance Abuse Prevention Skills Training and Introduction course. It is 4 days, 4 very long days from 8 to 1, but it's a great beginning introduction to the SPIF, the Strategic Prevention Framework. Someone says it's awesome and they highly recommend it. Glad to hear that. Oops, and I'm sorry to hear that this one is now full, but there will be another one in November, so keep your eyes peeled for that. It doesn't feel that great. Oh, thank you, Ruth. She said the SAPS doesn't feel as long as, because we always have good trainers. Cannabis, the new conversations for a changing landscape. That's gonna be August 16th. And I'm excited about that one, conversation about cannabis. We also have an upcoming webinar on substance misuse trends and strategies specific to girls and women, which I think is a important topic that we often don't get to address. And then in September, into October, we're going to have an alcohol policy series where we talk about approaches to policy, approaches to alcohol prevention through the use of policy. Unless there are other questions, we can go ahead and wrap up. I have really enjoyed hearing from you all today, and I'd really love to hear from you moving forward. So thinking about our post-training feedback, if you can, shoot your phone at that QR code, we're going to put a link in the chat so that you can click on that. We'll also push you out there when the meeting ends. If you just take those 3 minutes it takes to fill out that form, it would be incredibly useful to all of us. Thank you so much for being here. And there's the URL for the survey. I hope you found this to be interesting and useful today. Nope, and there's a save to date for the November SAPs. Thank you so much, everyone, for your, Melissa, it's good to see you too. Thanks, everyone.